I'm Marilu Biar sa inyo from St. Agustin School of Nursing, Lipa City, Batangas. And for now, my return demonstration I will show you is how to insert, administer, and removing the NGT or Nasogastric Tube. NGT or Nasogastric Tube is a special tube inserted through the nose for delivering oral nutrition supplements and medication into the stomach. You are required to put the patients based on the feeding schedule. Please take note of the time, type of oral nutrition supplement, and amount needed. The purpose of administering NGT are to feed the client with fluids when oral intake is not impossible, to dilute and remove consumed poison, to instill ice-cold solution, to control gastric bleeding, to prevent stress on operated site by decomposing the stomach if secretions or gas, and lastly, to relieve vomiting and distension. These are the equipment that I will going to use: the stethoscope, the pin light, the tongue blade, the improvised micropore tape, a cup of water with straw, pH strips, water-soluble lubricant, cotton balls, specimen cup, pad or a towel, the nasal gastric tube that is appropriate to the size of our client, and the disposable gloves. Remember to check the doctor's order for insertion of nasogastric tube because this clarifies the procedure and type of equipment required. You have also explained to our client because explanation plus facilitate client operations. Good day, ma'am. I'm Malu, your aide, and today we will doing NGT administrations. May I know your name, ma'am? How about your age? Okay. Ma'am, please allow me first to close the curtain for your privacy. Gather all the equipments because this will be providing accurate skills and performance. Assist the client abdomen because assessment determines presence of bound sounds and amount of abdominal distensions. Ma'am, I will be checking your abdomen. You're doing good, ma'am. Next is to perform hand hygiene. Then, wear disposable gloves because hand hygiene deters the spread of microorganisms. Then, place your patient in high polar position or semi-polar positions because upright position is more natural from swallowing and protect against aspirations if the client should vomit. Cover the patient's chest with towel or pad. This is to prevent from making any mess, then explain the procedure and make sure to develop any appropriate hand signals or gesture. After it, assist your patient for any facial or nasal passage issues using a pen light. Check the nostrils in the mouth of the client because tube passes more easily through the nostril with largest opening. Ma'am, I will just check your nose. Make sure the distance to insert the tube by placing the following. Place the tip of the tube at the end of the client's nostril extended to the tip of the earlobe. Starting here, up to the earlobe, and until here in the cyclose process. Then right after this, I will mark this using a marker or a piece of tape. Because measurement ensures that the tube will be long enough to enter the client's stomach. Once you mark the tube, lubricant the tip of the tube at least 1 to 2 inches with water-soluble lubricants. Because lubricants reduces friction and facilitates passage of the tube into the stomach, water-soluble lubricants will not cause pneumonia if the tube accidentally entered the lungs. Next is to build the patient's head back to the pillow and insert the tube until you reach the throat, because normal contour of the nasal passage while inserting the tube reduces irritations and likelihood of the mucosal injury. Ma'am, I just keep your head back. The client may gag when the tube reaches the parties. Next is to tilt the patient forward and have your patients take some sips of water while you continue advance to the tubing. Because the gap reflex is stimulated by the tube, encourage the patient to swallow even if no fluids are permitted, because swallowing helps advance the tube that causes epiglottitis to cover opening of the trachea and helps to eliminate gagging and coughing. If gagging and opening persist, check the placement of the tube with a tongue depressor and a flashlight if necessary, because excessive coughing and gagging may occur if the tube has to curl at the back of the trunk. When inserting the tube, do not use force. Rotate the tube. It means resistance, because forcing the tube may injure the mucous membrane. Discontinue the procedure and remove the tube. If the tube are signs of distress such as gasping, coughing, sinuses, inability to speak up or hop, keep advancing until we reach the marker. And then right after this, secure this with the tape. Take note, be careful not to pull the tube tightly against the nose, because contact pressure to the tube against the skin and the mucous membrane causes tissue injury. Take the stethoscope and listen over stomach. We will be listening for the gargling sound or the whooshing sound. If you hear the whooshing sound, meaning you place the tube in the right spot. Put the piece back in, then hook it up using a suction machine. Remove your gloves, then position the bed back down. Perform hand hygiene. Next is to report and record the procedure. Nasogastric tube feeding means that providing a liquid nourishment through a tube into the intestinal tract. When assemble all the equipment and supplies after checking the doctor's prescriptions for the tube feeding. You must check also the prescription. Confirms the type of feeding solution route and prescribe and delivery time. Today, we will be using a type of can formula. Remember to check the expiration date, because feeding solution may settle and requires mixing before administration. Outdated formula may be contaminated or have been lessen the nutritional value. Next is to perform hand hygiene. Then, wear disposable gloves because hand hygiene deters the spread of microorganisms. Position your client with the head of the bed elevated at least 30 degrees angle to 45-degree angle because this position helps avoiding aspiration of feeding solution into the lungs. Ask the patient to open their mouth and check the back of the throat because this is to ensure that the tube is not coiled. Ma'am, can you open your mouth? Ensure that the recommended external length of the feeding tube is measured and consistent during its feed. The feeding tube should be secured firmly to the nose and chest and cheeks with dip. Lay the patient on their left side. Inject 10 to 20 ml of air into the tube and make another attempt to withdraw gastric content. If you're still unable to gas to content, wait for 15 minutes to 30 minutes and try again. Prevent air entry into the stomach by heating the feeding tube before connecting the syringe. Flush the tube with 20 ml of water or as prescribed. Feed accordingly to the feeding schedule. Position the syringe slightly above the head and ensure the syringe is not empty during feeding. This is to minimize stomach discomfort due to excessive air entry. Complete the feeding by flushing 20 ml of water or as prescribed. Then, close the feeding port with a stopper. When feeding your patient with their medication, you must ensure that the right medication is being prepared. Get a cup and crush the medication finely or dissolve the pills in lukewarm water. After administering the medication, remember to flush the feeding tube with 20 millimeters of water or prescribed. Remove the syringe with this stopper and put back the connecting tube into the machine. The patient should remain seated for at least 1 hour to prevent gastric loss. Here are the precautions when doing or administering an NGT feeding. First is do not mix medication with oral nutrition supplement. Second is administer foods prescribed by your healthcare professional. And the third is consult nutrition nurse and specialists for other options that do not cause tube blockage. And last, use only water-filled syringe and apply pressure to plungers or plus and unblock the tube if your patient experiencing any of these symptoms. Do seek treatment immediately. Take off your gloves, wash your hands, and lastly, report and record the procedures. When removing the NGT, you must assemble the appropriate equipment such as the kidney basin, tissue, blue pad or towel, syringe, and alcohol, and the disposable gloves. Hi ma'am, how are you? Okay. Perform hand hygiene. Input your gloves. This is to prevent spreading of infections. Place the client's bed in position and put the blue pad over the client's chest. Remove the plastic connecting to the machine and place the stethoscope into the stomach area to check the respiration rate. Use an alcohol or adhesive remover to remove the adhesive while holding the nasogastric tube into the nose. Advise the patient to have a deep breath because we were pulling out the tube into the client's nose. Okay, ma'am, I wanted you to take a deep breath because I'm going to pull out the tube into your nose. Okay? Take a deep breath, ma'am. Here we go. Alright. Do not remove the tube if you encounter any resistance, not to harm any membranes or organisms. Do another attempt in an hour. Be sure to remove any tapes from the client's face. Provide mouth care if needed because they can provide some point to our client. Take off your gloves. Perform hand hygiene. Lastly, report and record the procedure. Thank you and God bless everyone.